You know HIV is real. Do you know your HIV status? I'm Dr. Esther Udotai and I'll be educating you about HIV epidemic control. Did you know that in 2018, 37.9 million people were living with HIV globally? And 1.7 million of those people were children less than 15 years. Now, did you know that 8.1 million people never knew their HIV status? You need to get tested. Did you know that in Nigeria, 1.9 million people were living with HIV and AIDS in 2018? And Akwa Ibom State had the highest prevalence with 5.5%, followed by Benue State. You need to get tested. When you get tested, you will help us achieve epidemic control by 2020. What is epidemic control? Epidemic control is divided into three categories. The first one means that 95% of people who have HIV should know their status. Now, get tested, because when you know your status, you will help us achieve the second 95, which means that 95% of people who are living with HIV and AIDS should be on antiretroviral drugs. It is free, it's easily accessible in a pharmacy, in a chemist, in a private health center, or even in a hospital. It is free and easily accessible to you. When you take an antiretroviral therapy, you will elongate your life and much more. You will reduce the risk of transmitting it to someone, which will help us achieve the third category of epidemic control, which states that 95% of people who are taking their antiretroviral therapy should have viral suppression by 2020. In context, this simply means if Mr. A gets to test himself and discover he's HIV positive, he takes his antiretroviral drugs continuously every day. It will elongate his life, it will reduce the risk of transmitting it to his loved ones and to his friends, which will now lead to the ultimate goal. Undetectable virus equals to untransmittable virus, meaning if the virus is not detected in you, you cannot transmit it to others. Join us and let's achieve epidemic control by 2020. Get tested, take your drugs regularly, and help us achieve viral suppression in